Hello, this is Javier Hall. We're going to talk about the topic of obesity, and for that, we're going to use this content, the book of Professional Guide to Health and Wellness Coaching, specifically the chapter 11 that talks about obesity, and obesity means having too much body fat, and doctors measure this using body mass index, waist size, and body fat percent. And basically, these numbers helps and tell the person is at a risk or for health problems. And basically, obesity has a multi-phase factors. It's a complex um, disease, and you as an exercise professional, your role is vital in reversing these natural trends, being and understanding this pathology. Okay, so let's talk about some statistics about obesity. Obesity is the second leading cause of preventable death in the United States. It can shorten a person's life 20 or 10 years, and is linking to serious health problems like high blood pressure, heart disease, and other one we're going to talk about. About the statistic, obesity in adults, according with the Center for Disease Control and Prevention, almost 4 in 10 adults in the United States had obesity. More women, you can observe the numbers over there, 40.4% than men, 35%, and older adults had higher rates than younger ones. And about obesity in kids and teenagers, we can observe the statistic over there. About 1 in 5 kids aged 2 to 19 had obesity, and the older the child, the more likely they were be obese. And other factor regarding the why obesity is serious, um, as we talked before, it can make life shorter by 10 to 20 years, and it can lead to many other health problems like hypertension, cardiovascular disease, type 2 diabetes, and certain type of cancers. And also have a role because obesity affect the mind. People with obesity may feel sad or anxious, judged or left out, or treated unfairly. It's not just about the body. It affects emotion too. And we, as an exercise professional, it's important understand the causes, understand how it affect body and mind, and help people make healthier choices in life. And we can observe in here how doctors diagnose overweight and obesity. Doctors usually diagnose overweight and obesity by calculating mm, a person's body mass index or BMI. And BMI is a number that shows the relation between a person age and weight. However, body mass index has some limits. It may not be accurate for people with a lot of muscle mass or larger body frames, or for older adults. It is because body mass index does not tell you the difference between fat and the difference between lean mass or muscle mass. And there are other ways you can observe on the screen to measure body fat more accurately. These include methods like DEXA, dual energy X-ray absorptiometry. This is stand for DEXA, or underwater weighting or hydrostatic weighting. These tests can give you better picture of how much fat and lean mass a person have. And in here we can observe the classification according with the World Health Organization. The World Health Organization uses the following categories for overweight and obesity. We can observe that underweight is less than 18.5, a body mass index normal between 18.5 and 24.9. Overweight is between 25 and 29.9, and there obesity class 1, class 2, class 3, according with these values. Class 1, 30 to 34.9, class 2, 35 to 39.9, and the class 3 or extreme obesity is 40 or higher of body mass index. We can we have another difference values to establish, and this is waist circumference and waist hip ratio. Waist circumference, in addition to body composition, to body mass index, sorry, is used for health professionals and check health risks related to weight. And waist circumference measures the size of your waist, usually used above the belly button. This helps show how much fat you have around your abs, your abdomen, and why it matters. Too much belly fat increases the risk of heart disease, type 2 diabetes, and other health problems. Even if your overweight seems normal, and we have some values in here of the risk level. Women, a higher risk level if waist is more than 35 inches or 88 centimeters, and for men, more than 40 inches and is 102 centimeters. And waist hip ratio, this ratio is calculated by dividing your waist size by your hip size. So the formula, you can observe it over there. There is an example. Your waist is 80 centimeters and your hips are 100 centimeters. You can observe, but the relevant risk level over there is, for example, the high risk of waist to hip ratio is 0.85 or higher in women, or 90 or higher in men. And about body composition tests. Body composition tests are different tools to measure what your body is made. Mainly how much fat, how much muscles, how much bone, and water you have. These tests give a better picture of your health than just weight for your body mass index alone. For example, two people may gain the same, but one may have more muscle and less fat, which means healthier body composition. Here is more about this body composition test. The most common are skinfold calipers. We're going to use too much this one during the semester. With the skinfold calipers, it pinches the fat under your skin in certain areas. It's a simple and low-cost method, best used by exercise professional. We have other one, bioelectrical impedance analysis. This sends a small electrical current through the body and measure how easily the current passes. Fat slowed it down, muscle doesn't. Found it may harm and gym skills. You can find it this one in here. We have another one is DEXA scan, dual energy X-ray absorptiometry, and this is for often used in university or labs, and uses a low levels of X-ray to measure fat, muscles, and bone density. Is very accurate and often sent in medical and sport and hospitals and labs university. The other one is hydrostatic weighting. We have this one in our lab, or underwater weighting. Measure body density by comparing weight in water and on land. Was once the gold standards for accuracy. Is less common today because it's harder to access. We're going to see it later. And we have other one is like the same, the hydrostatic weighting, but with air, is the BODPOT. It's air displacement plethysmography, similar to hydrostatic weighting, but uses air instead of water. Is fast and accurate and often use it also too in university or labs. And in here we can observe in page 299 of the chapter 11 of obesity, this table of general body fat percentage categories classification in women and men, the essential fat that we should have, the body fat in athletes, women and men, fitness person, average people, or obese women and men. It's important to keep that in memory, to have like a comparison numbers in your mind to act quickly, because body composition test helps you understand the what percentage of your body fat is or versus lean mass like muscles, and is useful for us in tracking health progress, especially when trying to lose fat or gain muscles, not just lose weight. Okay, so in here we have this important part, because research show there are several factors that affect weight gain. There's many science about it. We have 8 factors over there, like eating habits, eating too much, eating many high calories, processed or sugar food, or large portion. Physical activity is obviously done, not getting enough movement or exercise, or sitting for long periods. It's basically sedentary life. Genetics, some people are more likely to gain weight because of their family history. Genes can affect metabolism and how the body stores fat. Hormones factors, like during menopause, pregnancy, or thyroid problems, can lead to weight gain. Sleeping problems, not getting enough sleep, can affect hunger hormones and increase cravings. Poor sleep is linked to weight gain. Stress and emotion is another factor. Some people eat more when they are stressed, worried, or emotional. This is called emotional eating. And other one is medication. Certain medication may cause weight gain as a side effect, like steroids, like birth control, like antidepressants, and environment and lifestyles. Easy access to fast food can be a fact. Lack of safe space to exercise, or busy schedule that sometimes happen, can make harder to stay healthy. And in here we can check that preventing overweight and obesity is very important. We talk about that is linked with comorbidities, and one key strategy that we can use as an exercise professional is creating a negative energy balance to reduce the risk of this condition. Um, One main strategy is to create this. You can observe on the screen a negative energy balance. This means burning more calories than you consume. When your body use more energy than it takes from food, it start to burn store fat, leading to weight loss. Okay, so there are many strategies like healthy eating habits, eating small portions, eating fruits, veggies, increasing physical activity, establish the aim for at least 150 minutes of moderate exercise per week, behavior change, like keeping food and activity journal, set realistic goals, and get enough sleep is another strategy, and seek professional support like us. Can be a health coach, can be a nutrition, can be a doctor, but our role in here is very important. The importance of exercise science professional in weight management strategies. Um, we can personalize programs, the design of fitness plans that match with the person's safe and effective guidance for these people. Motivation support is very important. Exercise professional, it helps people stay motivated and build healthy habits and overcome barriers like confidence or lack of time. And other fact is monitoring the progress. We can track the changes in body composition and other factors like strength, endurance, and more. But understanding the losing weight, helping people to see their improvements and adjust their plan as needed. And education is another factor to understand how people with exercise helps with energy balance, fat loss, and overall health with these factors. Well, this was the topic of obesity.